Okay, well, let's start with pharmacokinetics. Now, pharmacokinetics is what the body does to the drug, whereas pharmacodynamics is what the drug does to the body. Now, regarding the pharmacokinetics, this includes 1. Drug absorption. So that means the absorption from the digestive tract to the bloodstream. That's for orally administered, so the pills that you take. Number 2, distribution. So that's the body moving the drug from one location to another. So think about the drug being distributed to various tissues throughout the bloodstream. So it can have its desired effect on whichever organ it's supposed to affect. And number 3, metabolism. So this is actually a biochemical change of the drug, and it's usually to the metabolites that can be eliminated by the body. Number 4 would be excretion, and so this is the elimination of the drug from the body. And this is typically in the kidneys. The plasma drug concentration is affected by all of those. So that's absorption, distribution, metabolism, excretion. Now, keep in mind, if the plasma drug concentration decreases, the drug effect decreases. This makes sense. If you don't have as much there, it's not going to produce the same effect. So the best way to think about this is to think about things that could affect each of these processes. For example, if the body can't absorb an orally administered drug, and that would be a pill, then the plasma drug concentration and the effectiveness of that drug is going to decrease. You can't absorb as much, you don't have as much, you don't have as great of effect. Now below I talk about how strenuous exercise actually will decrease absorption in the intestines. So the next thing to think about is the solubility of a pill. And so, what is that? It's the ability of the pill to dissolve an acidic solution. Like the stomach, it's usually a pH of 2. Now, if the pill doesn't dissolve properly, you can't absorb it. So remember, absorption is going from the gastrointestinal tract into the bloodstream. So you can't, pull in that horse pill into the bloodstream until it's broken down. Now, plasma proteins actually really do affect how effective the drug is, because if they're bound, then that free drug can't act. So that will definitely, more plasma proteins, it's a lower drug effect. Now let's think about the liver. And we know there are people who have liver impairment, or liver dysfunction. So if the liver is not functioning properly, it's not going to break down, which is metabolize, or take that drug into a different metabolites. It's not going to break down this drug, and that will keep that drug, more of that drug in the circulation. So it keeps the plasma drug concentration higher for longer. So if the kidneys aren't working, and remember, the kidneys are what do most of the elimination, so they may not eliminate those drug metabolites. So remember, metabolites, the name for the drug being broken down or changed, biochemically changed into another substance. So typically that happens in the liver, and then the kidney will eliminate that. So that doesn't happen fast enough. So what does that do? Well, that keeps the metabolites that may be active and have a partial effect, or sometimes even mildly toxic. So that can produce either a continued drug effect or produce unwanted effects. So let's move on to exercise. During exercise, the blood flow is redistributed, and that's usually to the muscles and the lungs. So keep in mind, the main organs involved in the pharmacokinetics of a drug are the liver, the kidney, and the gastrointestinal tract. So now they actually have less blood flow. So if we take strenuous exercise, think about the body. It's shunting the blood away from the gastrointestinal tract. And this is going to go to the muscles and the lungs. Well, now the gastrointestinal tract doesn't have as much blood flow. It's not going to work as efficiently as it did before. It just doesn't have the same nourishment and oxygen and everything else. So everything slows down, or its effect slows down. So this delays gastric emptying. So that means that the stomach contents enter the intestines more slowly. So remember that the stomach is going to start the digestive process, the breaking down, but the intestines do the absorption. So if the contents are entering the intestines more slowly, that means the drugs are absorbed more slowly. So overall, you're going to decrease the rate of absorption. And what does that do? That's going to decrease the amount of drug you have in your system. Now, what's a little bit odd is that strenuous exercise accelerates the transit time through the intestines. And it's mostly because the intestines aren't as active when you're doing strenuous exercise. So everything just goes through more quickly and there's basically less absorption. Now there's also the other confusing aspect is there are some training adaptations that occur. So trained athletes are actually not as affected by this effect. So if you take someone who normally doesn't take medication and maybe they're a weekend warrior or something like that, then they may be more affected by this effective strenuous exercise. So their drug may not be as effective. Now for the same thing, remember there are different routes of administration, and what does that mean? So we can take a pill, we can have an IV, we can put on a patch, or we can get an injection into the muscle. Now if you have an injection into a large muscle, normally they're injected into large muscles. So, and then you go out and you use that muscle, what happens? Well, the blood flow increases to that muscle. And if the blood flow increases, then that will increase the absorption of the drug into the bloodstream. So that increases the plasma drug concentration. So if someone had an injection into their muscle and they went out and exercised, they could expect to have a greater effect from that drug. Now this is also true for transdermal patches. Remember, these are patches you place on your skin. It gets absorbed from the skin into the bloodstream. Peripheral blood flow, so these are the small vessels that supply the skin. The blood flow increases, and it's because there's a vasodilatory effect, which means that the blood vessels open. And a lot of this has to do with shunting of heat. So they're going to increase in diameter, they let off heat, but this is increasing the blood flow to the area. So if there's more blood going to the skin, there's also more blood going from the skin back to the heart. So you're getting this increase in absorption of that drug from the transdermal patch. So the effect is the same. You're going to have a greater plasma drug concentration. Now remember, blood flow goes to the lungs as well. It's going to increase. But this effect is a little bit different because if you think about it, most of the inhalers are trying to act on the lungs. And you know, we got to this in week 6, but they're not necessarily meant to be absorbed into the bloodstream. So the effect varies based on the drug. But if you think about an inhaler, let's say for asthma, if you have greater blood flow to the lungs, you're actually going to end up absorbing that faster, which is actually going to decrease or shorten the duration of the effectiveness in the lungs. So it's kind of the opposite effect, at least in that regard. Now, the response to any drug depends on the amount of the drug given. And so now we're going to look at these dose response curves, so and time response. If we look at the dose response curve, we're looking at how much drug someone needs to get a desired effect. So how much? That's the dose response curve. The dose, how much? Now this is important because we want to give the least amount of drug possible to get the same effect. You don't need to take 10 times the amount of drug if you only got an effect from taking, 1 instead of 10. So why take more drug than you need to? If you give a drug, and let's say there's another drug or a substance, we can say substance X, that actually competes for that same receptor, and if that substance doesn't actually activate the receptor, that's called a competitive antagonist. So remember, agonist, that stimulates a receptor. There's an action that happens. An antagonist is going to inhibit it. So there's no action. And there's competitive and non-competitive, but competitive means it competes. It's there and it wants to bind to that receptor. It's not just going to hang out on the side and, wait and see. So that's a competitive antagonist. And in this instance, it's substance X. So if you have these two substances, our drug and substance X, they both are competing for that same receptor, This means that less of our drug ends up binding to that receptor. It's probably going to be 50-50 depending on, how strong that competitor is. So what is that going to do? Well, there's now less of an effect. So we actually need more drug. So as soon as we outnumber, we give more and more drug, and we can outnumber this competitor. We're bullying him out of the way, saying we want that receptor. So now we overwhelm the substance, and that gives us our desired effect. Now if we look at the dose-response curve, this means that the curve is shifted to the right because you need more drug to get the same effect. Why is this important? Well, a lot of people take multiple drugs, and there are also foodstuff substances that act as inhibitors or competitive antagonists. So this can actually be very important. So the time response curve involves one specific dose of the drug, and this is plotted versus time at a specific dose. So this is the time response curve. Now this is important for recommending the frequency at which to take a specific drug at a specific dose. So what does that mean? Well, that means, do you take the drug once a day, is it twice a day, 3 times a day? Well, they figured this all out and they plotted it on a graph. And an example is naproxen, which is Aleve, and this is a twice a day anti-inflammatory drug. Whereas ibuprofen, which is Advil, is taken 4 times a day for essentially the same effect.